Hello everyone, and welcome to today's episode of Dr. Ozello Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Today I'm going to talk about concussions. A concussion is often seen in writing as mild traumatic brain injury. You may see the M is in small case letters and then TBI is in capital letters. But a concussion is no joke. If you think you have a concussion, please see a medical professional immediately. Please do yourself this favor. A concussion is one of the most common and serious sports injuries. Some of the most common sports that it occurs in are football, wrestling, and hockey. It is also very common in auto accidents. If someone is wearing their seatbelt and they get hit from behind with a large impact, the upper body stays in place, but the neck gets whipped forward and backwards, and this can lead to a concussion. I'm going to give several definitions, and I'm going to speak about the 4 categories of symptoms of a concussion. The definition of a concussion. A concussion is a complex pathophysiological process affecting the brain which is induced by biomechanical forces. A sports-related concussion, which is often abbreviated to SRC, is a traumatic brain injury that results from biomechanical forces to the body, including the head and the neck. These forces induce pathophysiological changes in the brain, leading to somatic, which is physical, cognitive, and emotional symptoms, and sleep disturbances. 4 categories of symptoms for a concussion are physical/somatic, cognitive, emotional, and sleep. The symptoms that fall into the physical/somatic group are a headache, which is the most common symptom of a concussion, neck pain, nausea and vomiting, sensitivity to light and noise, visual problems, fatigue, dazed and stunned, and dizziness and balance problems. The symptoms that fall under the cognitive category include feeling mentally foggy, feeling slowed down, answering questions slowly, difficult concentrating, forgetfulness of recent events, repeating questions, and if it is a student, there could be a drop in academic performance. The symptoms that fall under the emotional category include irritable, sadness, depression, can be a personality change, anxiety, panic, more emotional or less emotional. And under the sleep category, the symptoms include drowsiness, they may be sleeping more, they may be sleeping less, difficulty falling asleep, or staying awake. Most concussions usually resolve between 7 and 10 days. Symptoms may persist longer for up to 33% of the cases. Symptoms persisting for a few weeks to more than 6 months are classified as post-concussion syndrome. I will be doing a video on post-concussion syndrome soon, so you'll be able to learn more about the specifics of that condition. Athletes with previous history of concussion have a significantly greater risk of receiving subsequent concussions. Long-term consequences of repeated concussions can be severe. The most common symptom of a concussion is a post-traumatic headache. You may see this abbreviated as PTH. Post-traumatic headache is defined as a headache that occurs within 1 week following the trauma. Majority of post-traumatic headaches resolve within 6 to 12 months. They are caused by cervical muscle tension and postural impairments. The most common mechanism of injury for a concussion is either a direct hit to the head or a hit to the body, which causes uncontrolled neck motion. Due to an abrupt linear or rotational acceleration or deceleration of the brain within the skull, the brain may contact the skull's hard interior. The mechanism of injury usually accompanies a cervical spine trauma or injury. Cervical spine is the medical name for the neck. Transmission of forces to the head during a concussion may result in trauma to the cervical spine. Axial loading, hyperflexion, which is bending the head too far forward, or hyperextension, which is bending the neck too far backwards, of the cervical spine are the most frequently reported mechanisms of injury to the cervical spine associated with sports such as football, hockey, and wrestling. Over the past several 10 or 15 years, concussions have been in the news a lot, which is a good thing because people are learning more about concussions. And one of the things that is often spoken about is CTE. CTE is chronic traumatic encephalopathy. It is a progressive neurodegenerative disorder linked to repetitive traumatic brain injury. This is common in athletes such as boxers, football players, wrestlers, and also in military personnel. It is characterized by cognitive dysfunction and behavioral changes. It can progress to altered motor function with Parkinson's-like manifestations in its later stages. Brain trauma is either repetitive, episodic, or a single event. Cervical musculoskeletal attributes such as neck strength may represent a modifiable risk factor for concussion. What I just said is extremely important, so I'm going to repeat that. Cervical musculoskeletal attributes such as neck strength may represent a modifiable risk factor for concussion. Musculature of the cervical spine has been identified as one potential factor in reducing sports-related concussion risk. In male and female athletes across the age spectrum, greater neck strength and anticipatory cervical muscle activation, which is bracing for impact, can reduce magnitude of the head's kinematic response. Increased neck strength and girth is associated with reduced linear and rotational head acceleration during impact. The overall body of literature addressing the relationship suggests that interventions aimed at increasing an athlete's neck girth and strength still holds promise as a means of reducing risk of sports-related concussions. A prospective study found that greater overall isometric neck strength reduced concussion risk in high school athletes. Neck strength, range of motion, and susceptibility to fatigue can be influenced using a focused neck training regimen. Research and literature has proven that having a healthy neck can reduce your risk of concussion. It can also reduce the severity of a concussion. So if you are an athlete, especially an athlete who plays a contact sport or an athlete who participates in a combat sport, do yourself a big favor and strengthen your neck. Perform a focused neck strengthening routine. So you strengthen your neck in all motions, including flexion, extension, right lateral flexion, left lateral flexion, right rotation, left rotation, and retraction. You can also strengthen your trapezius muscles, and you can strengthen your upper back muscles, including your upper thoracic spine muscles, because those muscles do help to support the neck. So do yourself a big favor and strengthen your neck. Disclaimer alert. If you have suffered a concussion, or you think you suffered a concussion, or you think you are suffering from post-concussion syndrome, please see a medical professional immediately. The short-term symptoms and the long-term symptoms can greatly alter your life in a negative fashion. Many times, people do not understand this, so please see a medical professional as soon as you can if you think you have suffered a concussion. And please remember, watching this video does not take the place of seeing a medical professional. Yes, I want you to educate yourself on what you can do to prevent a concussion and what you can do to help yourself if you have suffered a concussion, but please see a medical professional to get the proper diagnosis and proper treatment. If you have suffered a concussion and you have seen a medical professional for an evaluation and treatment, initial rest is important for return of cognitive function and symptom resolution. Then an integrated approach may accelerate symptom resolution and return to activity. After a brief period, 24 to 48 hours of complete rest, you can be encouraged to become gradually and progressively more active while staying below a cognitive and physical symptom exacerbation threshold. Active rehabilitation involving sub-symptom threshold and sub-maximal exercise can be included into your routine. You want to make sure that you keep the exercise very mild. If symptoms start to occur, stop immediately. Sub-threshold aerobic exercise normalizes the cerebrovascular physiological dysfunction and is medicine in quotes, for patients with concussion and persistent post-concussive symptoms. For supplementation, high doses of high-quality fish oil supplements 3 times a day for 7 days is recommended. This is a supplement that should help with brain health and should help with your recovery. So to summarize what you can do, in the very beginning, if you have a concussion and you have been diagnosed with concussion, rest is extremely important, especially for the first 24 to 48 hours. I even recommend longer than that sometimes. It may take a few more days. Every case is a little bit different, so you want to make sure that your symptoms have dissipated. Once they have, you can perform very light aerobic activities, even if it is just walking very slowly at a sub-symptom threshold. Again, I'm going to say that, a sub-symptom threshold. If any activity that you do starts to elicit symptoms or intensify symptoms, stop immediately. Also, for nutrition and supplementation, for any type of injury, you want to eat properly. You want to figure out what works for you. For supplementation, a high dose of high-quality fish oils has been recommended. You could do this 3 times a day for 7 days. Start the first day with just a small amount, and then as you go through the week, gradually increase the amount that you're taking and gradually increase the frequency. But fish oil has been proven to be beneficial for brain health. Thank you, everybody, for viewing today's episode of Dr. Ozello's Sports Medicine Report, a very serious episode where I spoke about concussions. Please, again, I know I said this several times, but if you think you suffered a concussion or you think you have post-concussion syndrome, please see a medical professional immediately. Thank you, everybody, for viewing today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries, which is available in paperback and ebook formats. You can visit my website, championshipchiropractic.com, where you can get additional information on the book. You could connect with me on other social media platforms, and you could visit my blog. My blog contains articles on sports medicine, health, fitness, and chiropractic. Please feel free to like this video. If you have questions, suggestions, or feedback, please leave them in the comments section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. Always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your goals.